Okay, Elva Zero.
Okay, ladies and gentlemen, welcome to one more of UECNA's interesting webinars. Today we have with us Dr. Thomas Munzel, who is a senior professor in the Department of Cardiology at the University Medical Center of Johannes Gutenberg University of Mainz, a cardiologist and angiologist. He's the initiator of the Gutenberg Health Study, one of the largest prospective cohort studies in the world, and also the founding director of the Center of Integrated Research and Therapy, IFP, of Thrombosis and Hemostasis, CTH, in Mainz, which is funded by the Ministry of Science since 2011. His research group has focused on environmental risk factors for cardiovascular diseases. As a senior professor, his research focuses primarily on studies on the combined effects of various environmental stressors, such as noise and particulate matter, on cardiovascular health. Tonight, he will speak about flight noise and cardiovascular diseases. Professor Munzel, the floor is yours.
So thank you very much for inviting me to give this seminar, and I'm very delighted. I was going through the webinar list, and you had some very important people already discussing the topic of noise. So how to proceed now? So let me start first with some thoughts. Why did I start doing noise research? So it's very simple, because I was living in an area in Mainz where the aircrafts were directly crossing my house. And then I thought maybe this stress caused by these aircrafts may cause cardiovascular disease. And it was around 2006 when I was starting also writing papers. And meanwhile, almost 20 years now of research, we have a pretty strong group together, and I'd just like to introduce to you important people. So this is Andreas Daiber. He's the head of molecular cardiology in Mainz, and we have Marin Kuntic, also a very exciting basic science researcher. And of course, we have a very nice network. So with Mette Sørensen in Denmark, Martin Rösli in Switzerland, and Matthias Basner, UPenn in the US. He's actually German, and he moved to the US, I think, almost 20 years ago. So let me start with the global burden of disease due to transportation noise. So I don't want to focus solely on aircraft noise, because sometimes we don't have enough aircraft noise data. So I have to supplement it with road noise, for example. So WHO is saying that noise is the most underrated environmental risk factors, the second most important environmental reason for health problems. 1.6 million healthy years are lost every year from traffic-related noise in western part of Europe. So this is a pretty incomplete picture. Each day, almost 150 million Europeans in towns and cities are exposed to noise levels more than 55 decibels. That's important, because the WHO defines more than 55 decibels and LDN. It's causing diseases, also where one expects actually adverse health effects. Next, we have the European Environment Agency. It's telling us about 900,000 cases of hypertension, 40,000 hospital admissions, 6.5 million people suffer from high sleep disturbance, and 22 million suffer from chronic high annoyance. And one of my, let's say, highlights in this talk is that I want to tell you this annoyance reaction. It's not something which is very easygoing. It's a real hard risk factor, and I want to provide to you evidence. And I also want to tell you that we have some new data from Mette Sørensen telling us, but this is just referring to road noise, that we can keep the levels below 55 decibel, that we will save 110,000 lives per year. So you know that maybe, you know, maybe also the next one. So the question is, what is this terrible noise doing to us? And on the left-hand side here, you see the decibel scale. And in the middle, you see the proposed mechanisms how noise may cause cardiovascular disease. And this was initially developed by Wolfgang Babisch from the Umweltbundesamt in Berlin. And he proposes two pathways, the so-called direct pathway, which are very loud, which means more than 100 decibel. So for example, like a jackhammer, and this causing hearing loss because it's damaging the ear organ. More important is the so-called indirect pathway that's around between 50 and 60 decibel, so in the level of conversation. So this may cause disturbance of communication, and if it's starting in the night, disturbance of sleep, and this will cause the annoyance reaction. So it makes you angry. And this means, of course, we have stress. And on the right-hand side, you see the stress responses. So we see an activation of the hypothalamic pituitary axis. So which means that in the brain, we get an activation also, or starting from the brain of the sympathetic nervous system. And we also release cortisol from the cortex of the adrenal medulla. Then, of course, it's important that Babisch also demonstrated when you have chronic stress, you promote your own cardiovascular risk factors. So you get a high blood pressure, high cholesterol, diabetes, activation of the blood coagulation. And then what we can catch first is endothelial function or endothelial dysfunction. This is actually my research topic for 40 to 50 years. And the important point is the first damage you can catch in the vasculature by risk factors is endothelial dysfunction. So it's actually going ahead of manifest atherosclerosis and early sign of atherosclerosis, if you want. And if we have this for years, we get manifest cardiometabolic disease, which means heart attack, stroke, heart failure, arrhythmia, and these are the main cardiovascular diagnoses. So I told you this annoyance reaction is a very hot topic. And I just show you in 2014, we had an article in European Heart Journal where we made this grading that aircraft noise is most annoying, followed by road and railway noise, which I completely agree because I was living close to the Autobahn, to the railway track, and also now in Mainz, close to Frankfurt Airport. And I must admit, aircraft noise is by far the most annoying. So the new relationship, which is done by Guski, is still telling us that aircraft noise is most annoying, and railway and road noise, there is no difference actually. Why is this important? So when we look for the hyena trial, which is a multi-airport trial, what they did one time was comparing, let's say, development of the annoyance in response to road traffic noise and to aircraft noise. So they have a European Union curve here. You have here the decibel levels and here the highly annoyed percentage. And what you can see here that the European Union curve and 10 years later, the hyena curve is almost identical. So within 10 years, there was no change in the annoyance development in response to road noise. But with respect to aircraft noise, we see a huge shift to the left. So the people are getting more annoyed at much lower aircraft noise level. What the reason for this is, we don't know yet, but it's really interesting because, you know, all the aircraft companies are telling us that the machines are getting less noisy, and so we would expect actually the opposite. But unfortunately, the annoyance development is increasing in response to aircraft noise. Now, a very important paper which was published in 2019 was coming from the Harvard University in Boston. And what they did, they measured the activity of the so-called limbic system. The limbic system is an important part in the brain, which is covering emotion reactions, fear reactions, but also annoyance reactions. And a part of the limbic system are the so-called amygdala nuclei. And so what they did, they did a PET-CT, which actually allows us to see the amygdala in a CT when the amygdala are getting activated. And they had two scenarios, a high noise level and a low noise levels. High noise means in this case more than 55 decibel LDN. Low noise less than 55 decibel LDN. And what they've seen actually in 500 subjects and injecting this tracer, they've seen the amygdala lightening. So above 55 decibel LDN, we see amygdala activation, emotions, and these are likely the subjects which are developing annoyance in response to noise. But interestingly, they went further down on the aorta ascendens, on this big vasculature, and what they've seen actually is strong evidence that there is inflammation of the vessel. So the vessel is inflamed. This is very important because we are usually saying that inflamed vessels are prone to develop very early atherosclerosis. When we have less than 55 decibel LDN, we see no amygdala lightening, and we also said the aorta ascendens is not inflamed. That's a positive sign. So what does this mean within the next 5 years? And this is the so-called Kaplan-Meier curve. And here again, we have the people being exposed to more than 55 decibel and less than 55 decibel. Less than 55 decibel means you have almost no survival problems, which means you didn't get cardiovascular death, myocardial infarction, heart failure, and coronary and peripheral revascularization. But when we had more than 55 decibel for 5 years, the cardiovascular event rate is much higher. So it seems that 55 decibel may indeed be, let's say, a threshold to divide cardiovascular side effects from non-cardiovascular side effects. On the right-hand side, you see this concept. You see, in this case, it was road noise and aircraft noise. You see amygdala activation in response to noise, sympathetic nerve activation, systemic inflammation, and other major adverse cardiovascular events. And actually, the New York Times in 2023 was bringing this in a nice illustration, actually. So when we have our noise, which is, of course, unwanted sound, then we see this amygdala lightening, yeah? And then we get the stress hormone release from the brain, from the thyroid, but also from the kidneys. And then we see sympathetic nerve activation. You see, it's distributed, the sympathetic nervous system activated in the entire body. And the last consequence is at the end that we get an inflammation of the vasculature in the brain, but also in our body. So next one, how to proceed. Now, and this is something you have seen from Dr. Hahat already. Annoyance causes cardiovascular diseases like arrhythmia. This is something which you heard about that I was able to introduce the Gutenberg Health Study for Mainz, which means we included 15,000 people into a prospective cohort trial. It started 27 and now we have reached 2025. So it's a beautiful way to study in the area of Mainz what are the risk factors for myocardial infarction, and we check for the traditional risk factors like cholesterol, blood pressure, and diabetes, but also for the new risk factors such as noise pollution and air pollution and heat. And what Dr. Hart has shown, when you have higher, let's say, noise annoyance levels going up to extreme, the likelihood of getting atrial fibrillation is increasing. So which means when you have stress, you get more this atrial fibrillation, which at the end means you can get also more strokes. And the important point is also that you can get depression and anxiety disorder. So when you have extreme annoyance, the likelihood to get depression and generalized anxiety is almost doubled. So the important point is when we measure the noise levels, we don't have the information whether the patient is annoyed or the subject is annoyed or not. So my feeling is, and we have to screen the literature, that annoyance reaction in combination with noise levels makes it much more accurate which subject being exposed to noise will develop cardiovascular disease in future. So we had done a study published in 2024 in Circulation Research, and what we could show is that for all cardiovascular diagnosis, which means ischemic heart disease, arrhythmia, stroke, heart failure, interestingly not for hypertension, the risk is increased to get one of these diagnoses by 3.2% per 10 decibel. And this was just restricted to road noise. And now a very important study, the UK Biobank study. And this was published, I think, 7 to 8 weeks ago. And I got actually this paper to review and to write an editorial. And I just want to bring to you the results of this aircraft noise study, because these authors used state-of-the-art methodology like MRI, so magnetic resonance imaging, to quantify the damage caused by aircraft noise. So these were the airports: Heathrow, Gatwick, Birmingham, and Manchester. And so overall in this UK Biobank, they included here for this part 26,000 study participants, and everybody of these guys had an MRI. So this is a huge database.
À quel titre vous autorisez-vous à ça?
Maybe switch off the microphone. This would
Qui
be
meurt à cause de cet aéroport?
Green, please, can you switch off your microphone?
That's a good idea. So they had two groups: higher night noise, which means higher than 45 decibel. So WHO recommends 40 decibel, and higher than 50 decibel LDN. So WHO recommends 45 decibel. So I must say pretty low noise levels were experienced by almost 3% and 8.4% of the participants respectively. Out of the 3,635 study participants, 2,500 did not move from home from recruitment up to until 2022. That's very important, because these guys were in the study until 2022, and it allowed actually to calculate the cardiovascular risk based on the results obtained in 2014. So the study started in 2011. Noise levels were provided from 2011. 3 years later, we had the MRIs, and the large group actually was followed until 2022. So this is the main information. And the results were that when we have more than 45 decibel at night, we see a 7% greater left ventricular mass. So the left ventricle, the heart is getting thicker, 4% thicker. And it's important, this 7% associates with a 32% greater risk of MACE, which means cardiovascular death and actually hospitalization because of myocardial infarction, stroke, arrhythmia, and heart failure. So this is a huge change just within 3 years, and a very important neutral methodology. The second result was looking at the dynamics of the heart, and they actually could establish that there was an 8% reduction in left ventricular performance, which is associated with a 27% higher risk of MACE. And they did also mediation analysis, and they could demonstrate that a high body mass index and high blood pressure actually are mediating these phenomena. And so the result clearly demonstrated that aircraft noise is not just a nuisance, but also a serious health risk, and in particular, the significantly more pronounced side effects caused by nighttime aircraft noise call for a consistent noise-free night from 10 p.m. to 6 a.m. So that's very important. We have to have a free night from noise, and I was able then to write a nice editorial, which was appreciated a lot worldwide. So, and these are some data which Dr. Omaha has shown already. So in a time where he was not yet in our group, and in particular Frank Schmidt and Askan Warnholz, in 2011, got the aircraft noise from Matthias Basner. So he was a sleep researcher and later moved to UPenn in the US. And what we did actually, we are taking aircraft noise from the Düsseldorf airport, and we exposed healthy subjects, which means healthy medical students, to aircraft noise 30 or 60 times per night. They were exposed to an MP3 player, and they were also equipped with a polygraphic screening device, SomnoWatch Plus, which allows to derive heart rate and blood pressure. So we had peak sound pressure levels of 60 and mean sound pressure levels of 43 and 46. So this is quite reasonable. So the important point is when we measure vascular function, this so-called flow-dependent dilation. I don't want to go into detail with this methodology, but it allows us to judge the amount of nitric oxide. You know, nitric oxide is a radical which is also released by nitroglycerin, is causing vasodilation. And this is produced by our body, by the endothelium. We can quantify the NO release with this technique on the right side. And the important point is when we measure endothelial function in the brachial artery, we can make conclusions for the coronary artery because we have established that there's a very close association between peripheral and coronary endothelial function. So we knew when we have diabetes dysfunction.
John,
and the question,
please, John, you must switch off all the microphones. You know, there's
so this
counting.
is
Yes,
yeah.
I will do. If everyone can switch off their microphones, that would be excellent because we are getting some feedback.
Yeah.
If not, I'm going to have to mute everybody. But I don't want to. Okay. Can you?
So I don't switch off.
No, you don't. You don't switch off. No. I will. That's why I don't want to switch off everybody, Thomas, because I'll switch you off.
Okay.
But let's see how we get on.
Yeah, there's still Mark Brink not switching off, not muting.
Yes, I'm going to have to just take a moment and switch people off.
So you are the master of the microphones. Now it's good. Now it's perfect.
Oh, okay.
Yeah,
think
perfect.
Still switched on.
Right. On you go, Thomas, and we'll see how we get on. Yes.
So we have to cut the movie now. So on the right-hand side, you see an example. For example, when we do this flow-dependent dilation, we have a diameter of let's say 4.9 millimeters starting from 4.5 millimeter, which means the nitric oxide production of the vasculature is causing a dilation of the vessel by almost 10%. And so the question was when we expose the healthy medical students to aircraft noise, whether the vascular function is getting impaired. So the interesting point was when we exposed them to 30 or 60 aircraft noise events that endothelial function was getting, there's still a lot of feedback.
Yes, there is. Let me just for a second just mute. I'll mute everybody, and then I'll unmute you, Thomas.
Okay. Okay.
Yeah.
So the interesting point was when we check for aircraft noise, we have seen that 30 or 60 noise events are actually worsening endothelial function, if you want, dose dependently. And when we gave acutely vitamin C, we see a strong improvement of the flow-dependent dilation. We've seen, interestingly, the same for railway noise. Again, giving vitamin C, we can improve endothelial dysfunction, so which simply means one night of aircraft noise, which is very exciting to see, already damages the vessel so that we can functionally catch it with this very important healthy subjects, which means HS, compared to people having coronary artery disease, when we've seen the deterioration of vascular function is much stronger in patients with established coronary artery disease, which makes sense because they have already vascular damage. And if they're getting exposed to noise, the deterioration of vascular function is clearly enhanced. And of course, based on this paper, which was making a lot of noise in Europe, we got a very nice editorial from John Dienfield. So he's the Pope of endothelial function, living in London. And he was writing a beautiful editorial, Nighttime Aircraft Noise Flying Towards Arterial Disease. And so he speculated, of course, when we have aircraft noise, we get stress hormone release. And this damages the endothelium. And this is mainly because we produce a lot of superoxide. We have seen vitamin C is helping. So oxygen-derived free radicals, oxidative stress, is occurring in response to noise stress and impairing vascular function. And so we wanted to understand the molecular mechanism, and we developed an animal model. So we were exposing mice to 85 decibel, mean sound pressure levels were 72 decibel for 1, 2, and 4 days of noise. And actually, when we published our first paper in Nature, so that's actually Nature Reviews Cardiology, that's our best cardiology journal, they applauded to our approach because it was the very, very first animal model which allowed us to study the molecular mechanism of cardiovascular damage in response to transportation noise. And these were the initial results, not very surprising. You've seen the red lines means noise is increasing blood pressure, the systolic blood pressure and the diastolic blood pressure. And then we have the so-called stress hormones, noradrenaline, dopamine, angiotensin 2, serum adrenaline in response to 1, 2, and 4 days of noise. And you see every stress hormone parameter is increased for 4 days in response to aircraft noise. And then we measured also endothelial function in the mice. So remember, in human subjects, 1 night of aircraft noise is causing endothelial dysfunction. Yeah, and you see here, it's a relaxation of a vasculature. So what we do is we take the aorta and put it in an organ chamber. We pre-constrict the vasculature by giving a vasoconstrictor, and then we add this acetylcholine here. This is an endothelium-dependent dilator, and this causes a relaxation of the vasculature, which means a loss in tone. And this is shifted to the right, which means we have endothelial dysfunction. And we have this also like in the human being after 1 night of aircraft noise. So if you say the mouse is a mouse and you cannot compare it to humans, it's very exciting to see that the time course and the degree of endothelial dysfunction goes between humans and mice completely parallel. And then we also measured the nitric oxide production. You know, this is the one which is produced by the endothelial cells, like, let's say, nitroglycerin, which is produced by our vasculature. And we see that this NO production is significantly reduced in response to aircraft noise. And now, of course, we have to check why is nitric oxide reduced. And one concept is that the vasculature produces superoxide. We have seen vitamin C helps, so it must be oxidative stress. And you have to consider that this superoxide is like a Pac-Man eating up nitric oxide, and then you get this peroxynitride, ONO minus. And this is, let's say, a very important stress factor causing a huge amount of oxidative stress in vascular tissue. And you can see here this brown color, which reflects peroxynitride in response to 1, 2, and 4 days of noise. So usually you see this in diabetes, hypertension, smoking, and high cholesterol people. And we got it within a very short time frame in response to noise stress. And so we have a nice cartoon now, noise causing stress hormone release, causing reactive oxygen species, ROS production, and this damages the vascular, leading to endothelial dysfunction and also hypertension. So the next question was, nighttime noise is in particular damaging, and you know this already, that when our sleep is getting too short, then we get an enormous stress, which may have an additional negative impact on our vascular function. And the important point is, for example, from the hyena study, this multi-airport trial, that they could catch actually an increase in blood pressure just in response to nighttime noise, not in response to daytime noise. So it seems when we have nighttime noise, we have a special situation making more stress, so less than 6 hours of sleep or frequently interrupted sleep. And there are additional studies from the hyena trial from Greece and France, and both actually measured that nighttime noise is increasing blood pressure, daytime noise not. And so what we did, we exposed our animals to nighttime noise and to daytime noise. And the interesting point was when we exposed them in the sleep phase to nighttime noise, we see again this endothelial dysfunction. So the vascular is getting damaged. But when we expose them during the awake phase, we see no damage at all. So it's completely restricted to nighttime noise. And we also see the blood pressure is significantly higher when we have nighttime noise and not as high when we have daytime noise. So it seems this nighttime noise situation is stressing the animals quite a lot. And so our concept is when we have nighttime noise, we see interestingly also an increase in oxidative stress in our brain, which may cause at the end this cognitive development retardation in children. So this is maybe linked to oxidative stress. And we see the stress hormone release. We will get sleep disorders, which actually further enhance the side effects of noise. And we get vascular dysfunction, which at the end will lead to more cardiometabolic disease. Metabolic disease means, of course, also diabetes. So the next point is myocardial infarction. What happens when we expose mice to aircraft noise and then they suffer myocardial infarction? And this is here the protocol. Here are the mice, they're getting exposed to aircraft noise. Then we make an artificial myocardial infarction. And then we measured with ultrasound the heart function. And what you can nicely see when you have noise exposure before your myocardial infarction, you see that the ventricle of these animals is larger, and interestingly, the function of the ventricle is worse. So it appears when we have aircraft noise and then we have a myocardial infarction that our left ventricular function is worse, which at the end means, of course, over the long-term run, we have a worse prognosis. And this was checked also in our Gutenberg health study. In this case, again, we don't have the decibel levels, but we have the annoyance reaction. And for all people being included into the Gutenberg health study, which experienced a myocardial infarction, and this were quite a lot. And those who had annoyance reaction, they had a worse ejection fraction compared to those having no annoyance reaction. So again, the annoyance reaction is a very important parameter, which at the end will actually strongly enhance the stress response, which is usually experienced in response to noise alone. And when you have this annoyance reaction, in addition, everything is getting worse. And we have also evidence when you have annoyance reaction that the C-reactive protein, which means inflammation of the serum, is significantly increased. What happens when you have a myocardial infarction, and after myocardial infarction, you have more noise exposure? And this is a beautiful paper which was done by Professor Kaltenbach. So he was the climate cardiologist, let's say, before me. And he's now 95 years old, and he was the senior author on this work. And what he actually demonstrated is when you have an acute myocardial infarction and you get the next 5 years exposed to noise, LDN 35, 40, 50, and 60, the likelihood to get another myocardial infarction or cardiovascular death is strikingly increased. So when you survive a myocardial infarction and you live further in an area where you have a lot of noise stress, this will be not a good prognosis. So what we can do to mitigate transportation noise side effects. So we have now studied one approach by activating the endothelial AMP kinase. So it's not important that you understand what the enzyme is doing, but we had 3 approaches: exercise training, intermittent fasting, and ICAR treatment. ICAR means it's like metformin, a very important anti-diabetic drug. They all activate this enzyme AMP kinase. And what you can see is noise is increasing blood pressure in all 3 groups, but exercise training, intermittent fasting, and metformin is able to catch or to normalize blood pressure. And we see that endothelial dysfunction occurs in response to noise, and this is all corrected again by exercise, fasting, and metformin treatment. It's also important when we use anti-stress medication like beta receptor blocker or alpha receptor blocker, can we modify vascular function? And this was just published a couple of weeks ago, where we could nicely demonstrate that alpha and beta receptor blocker can nicely improve endothelial dysfunction. So red means dysfunction, and then you give phenoxybenzamin and propranolol, also beta receptor and alpha receptor blockade. You can completely normalize vascular dysfunction, and you also can nicely reduce oxidative stress in the vasculature. So you can nicely see oxidative stress, the red color, but when you give a beta blocker, everything is normalized. So this is something which I experienced personally. So I have, unfortunately, high blood pressure. I'm pretty convinced this is also a consequence of this aircraft flying directly over my house. But let's say during the last 4 or 5 years, when I was taking this beta receptor blockade, I'm much more resilient to noise, and this is maybe a consequence of this beta receptor blocker. Important point is co-exposure. So when we have noise pollution, we also have air pollution. So with respect to aircraft noise, of course, we have ultrafine particles being around, and just one example concerning the combination of aircraft noise and ultrafine particles, the CE Delft study, where they actually demonstrating that 280 cases of high blood pressure, 330 cases of diabetes, 18,000 cases of dementia, and among the 51.5 million people living around the busiest airports in Europa are the consequence of this ultrafine particles. So this is something which is, for me, still a black box, but I'm pretty sure that these ultrafine particles, which are very aggressive and they can penetrate every tissue. So after inhalation, they can enter directly the brain and activate structures in the brain, which cause immediate high blood pressure reactions. So this is one of these incredible side effects. And so more research is required. So we have in mind now exposure chamber. We put the mice here, and then we can transfer particle PM2.5 or ultrafine particles into this cage. And you can see here the speaker, so we can expose them simultaneously also to aircraft noise, which allows us to cause simultaneous exposure of our animals to noise and air pollution. And this has quite substantial side effects. So in this case, you see by giving in the retinal vessel, which means the eye vessels, acetylcholine, which causes a vasodilation of the vessel. So you get an increase in diameter up to 35%. And then you have air pollution exposure. This relationship is getting worse. You have noise exposure. It's also getting worse. And when you have both air pollution and noise together, we have the worst vascular function. So I think there is no doubt that there are additive negative effects of air pollution and noise pollution. And you see the same here with respect to radical production in the vasculature. Now, the good news
Thomas,
is that
we're going another 5 minutes, yeah?
1 minute. 1 minute.
1 minute even. Oh, brilliant.
So the important point is that we get funding. And if you talk to noise research, everybody's complaining that people don't understand what the problem with this noise, the European Union doesn't understand. But this changed now completely. And just last year, Andreas Diver from my lab, he actually acquired a grant totaling 9.3 million. It's called Marco Polo, Markers of Pollution. And we are happy that we have a huge group now together from entire Europe tackling this environment problems. So what is the future? This is my perspective. And because it's really incredible. So I've seen this calculation in a German statistic. I think it's also from the government. So they actually in 2025 they proposed we have 5.2 billion aircraft passengers, and this will go up until 2050 to 10.038 billion people. And what is important, the total world population will have 9.7 billion people in 2050. So this is an incredible growth, and I hope they are not right. Thank you very much for your attention.
Thomas, thank you very much indeed. That was absolutely fascinating. Sorry I had to mute you, or one or two of you were making a little bit of a noise, but
Make noise, yeah.
Feel free to turn on your cameras if you wish, because I think it's always easier for the discussion. So, Thomas, thank you so much for that. I'm sure people will have questions, and we'll start them in just a second. One question I've had a number of people who can't be on the call ask me to ask you is about low frequency noise,
Yeah.
and whether there's, one of the reasons why planes seem to be getting quieter, as you were saying, but more people are affected. Is the reason for that possibly low frequency noise?
Don't think so. So one question is, does this infrasound has any cardiovascular side effects?
Yes.
And so we had a big discussion in Germany because, unfortunately, a cardiovascular surgeon from Mainz, he was doing some isolated heart experiments and exposed them to infrasound, and he then measured that the heart function is getting worse, and he was proposing infrasound is a bad thing for the heart. And there was then a huge discussion with physicists from Bayreuth, so real experts in infrasound. I suggest that cardiovascular surgeons don't know too much in theory about infrasound. And he was giving a very nice example. So if you close the door in your laboratory, and measure infrasound, this is 1,000 times more than infrasound produced by a windmill being 1 kilometer away from a house. So which means it's completely, let's say, irrelevant, he's saying, this infrasound production.
Thank you for that. Okay, there's some hands up. You'll need to unmute yourselves when you speak, obviously. Daniel, and then Elefthera, and then keep putting your hands up. There's a lot of people on the call. I can't quite see everybody, so if I miss you, just start speaking. But Daniel first.
Okay, John, thank you so much. Great talk. I learned a lot. A couple things. First, the new definition of noise, which I published in 2019 and was adopted by the International Commission on Biological Effects of Noise in 2023, is noise is unwanted and/or harmful sound. So I'll send you that link. I'd appreciate it if not you, but everyone uses that, because noise, as you've demonstrated, is far more than just unwanted sound.
Okay.
And that minimizes the importance of noise. In terms of aircraft noise being quieter, but people complaining more, I think the trick that the manufacturers use, the industry, is they measure in A-weighted decibels when it should be dBc or unweighted decibels, and there are other measures as well that are more popular in Europe than in the States. But I think that explains, or may explain, the difference. And finally, in terms of 55 decibels, I have an article last year in Journal of Exposure Science Environmental Epidemiology. And again, I'll send the link. I think that 55 dBA is also the sound pressure level at which auditory damage begins. That is called the effective quiet level at which the human ear begins to recover from noise-induced temporary threshold shift. And I think there's something magic about that, and I'll stop there.
So the interesting point is when I also show to you that per 10 decibel, the cardiovascular side effects increase by 3.2%. So a summary: ischemic heart disease, blood pressure, stroke, and everything. The important point is when this relationship starts, and Martin Rösli and Mette Sørensen, they have some data showing, but this has to be proven for the future, that this relationship already starts at 35 decibel. So very, very low. And I think the 55 decibels are clearly too high. And there are many studies published by several groups showing that you have an increase in let's say, cardiovascular death already at the rate of 45 decibels. So it's important now to demonstrate to the WHO that they have to reduce this limit from, let's say, 55 to 45.
Thanks. Elvathira and then Jamie.
Okay, thank you, Professor, for this presentation. And I wanted to ask you, the results and the consequences of aircraft noise are so shocking. So why do you think the governments and the EU officials keep closing their eyes and their ears to what scientists say? And what do you think as a scientist, what do you suggest must be done from the EU officials about noise?
Yeah, so here in Frankfurt, I experienced a lot of wind against me when I was publishing our study results. So usually when we had some new results showing that aircraft noise is causing cardiovascular damage, we always made at the same time a press conference. And of course, Fraport, the owner of the Frankfurt airport, was very aggressive. And I think this is one of the problem that these airport owners are very strong in lobbying. You know, these are billions of euro which are getting lost if they are coming very strong, let's say, restrictions concerning noise levels, or let's say special active sound reduction maneuvers, like let's say this continuous descending approach, or flying higher, landing steeper, or approaching an airport GPS guided over, let's say, population poor areas. This is something which the airport owners don't like, and so that's why they fight against all this science. And the important point is, and I told this John already, that I got now a chair position for the European Society of Cardiology. So I'm head of the task force Environment and Sustainability. And what we do now, we try to bring into our guidelines, prevention guidelines, acute myocardial infarction guidelines, and other guidelines also, the topic of environmental stressors into the guidelines as important risk factors. And I'm pretty confident that we can do that. And, you know, if the politicians see that the cardiologists say noise is a very important cardiovascular risk factor, and air pollution and the co-exposure even enhances the cardiovascular risk, then maybe they will follow us a little bit more. And in addition to that, I was also chosen for the advocacy board. So I have the chance now the next couple of years to go to Brussels and to talk to politicians why the environment is an important cardiovascular risk factor. So that's a bright future for me. And it's very exciting that I maybe can, let's say, convince the politician that the environment is important.
That's great news, Thomas.
Thank you for your efforts.
Jamie and then Stephen.
Jamie.
Yeah. Hi, Thomas.
Hi.
You know each
Well,
other.
first,
You know each other across the
yeah,
Atlantic, yes?
Of course.
we do.
Great.
Well, thank you first for a great presentation, and I'm so delighted to hear about all the new appointments. I hope we can do similar things in the US.
I
Um,
doubt. I doubt.
Don't say that, Thomas.
I doubt.
So a couple of things. With
Yeah.
regard to the low frequency noise issue, I have more of a comment and wonder if you could consider this. So we know that aviation noise has strong low frequency components in it, and that this is not adequately measured by the DBA, but
Yeah.
it's these strong low frequency components that enables sound to travel over long distances and penetrate walls and windows. So we're really talking about the inability of people to close their doors and windows and be free of the sound in their own homes, control their own environments, sleep continuously. So I'm wondering if that low frequency sound has that indirect impact, by, I think you get what I'm saying.
Yeah,
So that's one.
I'm not an expert in that, but I must say if like the previous speaker was saying, clear evidence that the infrasound is very important. So then measure DBC, but there's no problem, and I would do it in parallel, measuring DBA and DBC and look what is. For example, for annoyance, if DBC is important, maybe the annoyance reactions can be even better categorized when we measure both DBA and DBC, maybe.
Yeah, and well, thank
As I
you.
told you,
And
I'm not an expert. I just want to say the experimental evidence we have so far is very weak in Germany, and if people expose, let's say, isolated beating hearts to infrasound, to extreme high levels of infrasound, there's not much going on. But this doesn't mean that there is no interaction,
yeah, and to me, the association could be indirect. It's that enhanced annoyance because of not being
that's
able to
positive.
sleep in your home and to have that stress.
But the
in your
interesting
home.
point, let me say one thing. When I was moving here in Mainz into this area, aircraft crossing my house directly, so I was almost annoyed. I was running into the garden, measuring the noise levels, calling Fraport, and complaining a lot. And I had this for, let's say, almost 10 years. And since 5 years, I can completely eliminate. I'm resilient now to this aircraft noise. So sometimes I'm asking my wife at 4 p.m., do we have aircrafts? And she's saying, oh, since 5 o'clock in the morning, didn't you hear them? So this is really, for me, it's very exciting. And so I speculate because when I was starting this beta receptor blockade therapy, I was feeling much better, this anti-stress medication. And the interesting point is we could reduce oxidative stress in the brain also with the beta receptor blockade. So this is maybe, let's say, a pharmacological approach to minimize this annoyance side effects of. On the other side, of course, we have to do more studies to confirm this. So it's just a hypothesis.
Yeah, thank you. And if you'll just bear with me, I just had one more question or request. Can you, given that aircraft are quieter, but you see this very substantial increase in people that are highly annoyed, can you comment on the possibility that this is being caused by repetitive flights, a much higher volume of flights, and also related to that, the priming effect?
Yeah, pretty sure that this plays a role, and so my feeling is that let's say the experience of the pilots also plays an important role, because if they're flying too deep, they always have to accelerate in between, and this let's say gas giving in between, this is also very, very disturbing. But climate change, of course, will also do their contribution, and I think also getting more heat waves or something like that, of course, it makes the people more vulnerable maybe to the same decibel level. They get more damaged when they are exposed to heat for a couple of weeks,
Thanks very much,
Thank you.
Thomas. Stephen, your hand went up and then came down, but I suspect that's a mistake. So do you want,
no,
do you want to come in?
My question was answered. Thanks very much, John.
Okay, great. Elaine, and then Debbie.
Okay, there I am. I want to thank you for the wonderful presentation. And I just wanted to ask one question of you at this particular point. For the people who have to endure the nighttime flights, continuous nighttime flights, and the exposure to health damage, what, besides taking vitamin C, I know you talked about the beta blockers, but what have you done any studies on wearing of earplugs or white noise monitors or anything like that that reduces the impact of the nighttime flights?
That's interesting that you are also mentioning white noise, because we compared aircraft noise to white noise, same decibel levels. And of course, we found that aircraft noise is much more damaging and white noise is rather protecting than damaging. It's a very interesting observation also. This noise silencing headphones and earplugs, I'm not a fan of it. I'm not aware of any study investigating this, but just speaking for me, so if I use earplugs, I'm getting nervous, it's a strange feeling for me. And if I have earplugs, I always try to listen whether I'm hearing something. So even I'm protected, I'm getting activated. And I wanted to hear, are these earplugs 100% secure or are they not? So it doesn't help me a lot. It's causing more stress in my body, stress responses. But there were no studies at all. What else did you want to know? So earplugs, that's, I think, the important point.
Oh, we've lost you, Thomas, for a second.
For now, European Union directive, so it's law. And from 2030, we have also air pollution limits of 10 microgram per cubic meter. This will be law, and when we have higher levels, we have certain organizations in Germany which can kill the traffic. And so what we want is that the WHO recommendations are getting European law, and this is something we have to fight for. But the aircraft industry and the airport owners, everybody's saying this is by far too low and there's no chance to get this. We will see. For me, it's important because this very important side effects of nighttime aircraft noise, to get an aircraft-free nighttime, The nighttime in Germany is defined from 10 p.m. to 6 a.m. in the morning. And if I have this in Frankfurt, now we have 11 to 5. If we have 10 to 6, then I'm happy, then we are on a safe side, I would say, because there's very strong cardiovascular side effects when we focus solely on nighttime noise.
Thanks for that, Thomas. Debbie, Armel, and then Ulf.
Hi, John. Thank you, Dr. Munzel. Very interesting, and your reputation does precede you, for sure. I have a question about the cumulative effects of both the noise and the ultrafine particles together. I've been concerned about that for a long time because, as you know, too, the ultrafines penetrate homes, and you talked about the deep penetration into the body. There haven't been much studies on what's on the ultrafines. They claim they're so small that it wouldn't be much, or that they can't carry things. But
so the surface to let's say, what would you say, this ratio which regulates the capacity to put stuff on the particle is let's say the worst for the ultrafine particles. So they can be covered by a lot, and this is something which, of course, has to be discussed. What makes the toxicity of these ultrafine particles?
Right. So I'm curious about the mice model of exposing both simultaneously. Does the effects become twice as bad or a third greater?
It depends on the parameter you're measuring. Sometimes we see doubling, sometimes no change. For example, blood pressure is exactly the same. I showed you the reaction of these very small retinal vessels, which was exceptionally just doubled the side effects. And also the free radical production in the vasculature was doubled in very small vessels. But we see, let's say, sometimes an accentuation, sometimes not. And, you know, the problem I have currently with ultrafine, we know it's a killer, but we don't know which level is dangerous. You know, there are no studies showing.
Right. Well, if it were
trying to calculate the global burden of ultrafine particles.
Okay.
If it were regulated, it would have to be by particles per centimeter cubed and not by weight or mass. But my last question I wanted to ask,
the number is important. The number of particles.
Right.
Yeah,
and we found 60,000 particles per centimeter cubed, and it looks like a 10-mile area around the airport is being affected, and the health outcomes are bad. Where do you think it's safe to live?
There is no threshold recommendation by the WHO, and I'm a cardiologist, so I'm not aware of studies saying this is causing cardiovascular disease and this is causing dementia or neuroinflammation or so. I think we have no threshold like we have for PM 2.5. So I think we are far away.
Yeah, I agree. Where's it safe to live near an airport?
Of course not.
Okay, let's let's move on fairly quickly if we can. Amel, Ulf, and then Christian, you raised a hand.
Right, Ahmed Thomas, within a mile of Heathrow Airport. You mentioned, thank you very much for your presentation, which was obviously very important to some of us around Heathrow. But you did mention metformin, and metformin on a long, taken a long time can actually be damaging. I know personally because my husband had to come off it. So it has its downside as well. Thank you.
So metformin, the important point is that it's an anti-diabetic drug. So you have diabetes and taking metformin. So the metformin is also taken by normal people without any disease, and because it has also proposed to have an anti-aging effect. And what we do with this metformin, we just checking this, let's say, pharmacological approach, increasing the activity of the AMP kinase, and then we see blood pressure normalization and let's say normalization of endothelial dysfunction. So from the experiment point of view, it worked great. And it was just a treatment for 4 days, or short-term treatment. So no speculation about long-term effects.
Okay, thanks for that. Ulf, and then Christian, and then I think we'll bring things to a close. But Ulf, on you go. Welcome.
Thank you. Thank you, Thomas, for a very interesting presentation, as expected. I have a question, and I also have a small comment. First, the comment is about the infrasound. We have learned that the infrasound in nature is chaotic, and the infrasound you are measuring in the room is chaotic. But the infrasound from wind turbines has a pulse nature. Can that mean a difference in how you react on this? It was a comment, but it ends like a question. And the second question for me is, I noted, I think I heard that if you already are vulnerable, have a weak cardiovascular function, you are more vulnerable to more noise. It will accelerate the negative. So if the authorities neglect their noise responsibility, they are neglecting the people with the cardiac weak system.
Completely right, and you know, it's the same with air pollution, because the vulnerable people, cardiovascular disease people, have more heart failure, decompensation, myocardial infarction, and strokes if they're getting exposed, in addition to their cardiovascular disease, also to high concentrations of PM 2.5, for example. But overall, the literature concerning air pollution is much, much better. So we have to continue with our noise research. And the important point is also the European Environment Agency has realized, let's say, we have a very complete air pollution map from Europe. And for noise, we have many holes in it. So it's far from being complete. And this is something which is very important. They have to collect everything so that we can really calculate the burden of disease of noise, which is much, much higher than we think currently, because we didn't actually assess all the noise which is occurring in Europe.
Thank you. As you know, I have tried to arrange a meeting with you, with the Norwegian Parliament. I am still working on it. We have to change the topic of the invitation, but I think that you will have a huge impact on the Norwegian government and Parliament if we can arrange this still.
Absolutely, it'll be arranged, Thomas. Okay. Last question from Christian.
Thomas, thank you very much. Very insightful. Like Munzel, I live very close to Heathrow. I live within 400 meters of the northern runway, also under threat of compulsory purchase. So having lived here for 50 years, I have ADHD.
You're looking quite good.
Thank you. Kind of newly invigorated with the campaign against both easterly alternation and also the third runway. I'm also chair of the Residents Association. So I'm very interested, and I come back to Debbie's observations about UFP and also to yours. We are deeply concerned on two fronts. Noise for Heathrow around all their planning applications and everything is always based on models. And we've always argued that there are significant gaps because those models are based on sound receptors that are several miles from the airport, and the only reason they're there is actually to look at the calibration of aircraft in line with their specifications. They're not representative of how it actually interacts with those communities. UFPs are kind of, and I appreciate this is more to do about noise, but I do feel they're intrinsically linked, as you've highlighted, with the health impact. The WHO recommended of 10 to 20,000 over, I think it's a day period, or in excess of 20,000 particles per cubic centimeter. Heathrow has known for the best part of a decade that the monitoring station inside their perimeter, which is LHR2, those figures for daily exceed the WHO guidelines by at least 300%. So they're roughly 40,000 over a 24-hour average. They go up to 190,000 or thereabouts on the daily, on the hourly range. So that's actually 14.5 times the WHO recommended limits. Now, those are publicly available in the thesis that was done on.
But you know that, let me just give you one comment. The WHO recommends 5 microgram per cubic meter for PM 2.5, and 99% of the world population is living in areas higher than 5 microgram per cubic meter.
Okay, so is your argument that the
I just want to say that if you let's say number the people living in areas having higher concentrations, so I think the important point is the WHO has to come down very low, but I'm not so sure that with ultrafine particles we have sufficient evidence concerning the health side effects like we have for PM 2.5. So that's what I'm.
Okay.
So what I've learned that last week is that in Frankfurt they stopped measuring ultrafine particles. The Fraport decided not to measure any more ultrafine particles. That's a scandal, you know. I just have to check whether this is indeed the case.
Very quickly, Christian, if you may.
Yeah, I was just going to say the thesis on Heathrow talks specifically about the unburnt hydrocarbons and the risks of those elements within UFPs and their high concentrations. The reason that the government is not looking at, well, the recommendation from the study that you said was that there should be an increase in UFP monitoring. The government planning at the moment doesn't actually cover UFPs. It obviously only covers the traditional kind of air quality elements. So that's something that we really need the public to be lobbying their MPs to actually get that legislation in place and for those things to be improved.
Great. Okay. Thank you for that, Christian. One or two things from me to end with. First of all, this has been recorded, and the recording will go up on the UECNA website, hopefully within the next 2 or 3 days.
You have to work on it a little bit because of the interruptions.
Indeed. Yes, absolutely. Thomas, a number of people have asked in the chat whether your slides might be available. Would that be possible?
I send it to you as a PDF file. So
yes, send it to me as a PDF file, and we can then put them up on our website. The final thing from me is to say I'm delighted that Jamie will be presenting our next webinar on the 19th of May about a fascinating survey that they've done in the States. So that will be great. And Elefthera, it just leaves me to hand back to you for a final few words.
Thank you, John. We must thank Dr. Munzel for this excellent and enlightening presentation. And thank you all for being here. As you heard, the recording will go up soon. And we hope to have you with us at our next webinar. Thank you so much. Good night.